If you're a man over 50 taking L-Arginine capsules or powders regularly, thinking it's going to fix your erection problems or make you harder and stronger, I need to stop you right now and tell you something critical. And I know this might be frustrating to hear, especially if you've already invested money and hope into these supplements. But the truth is, taking L-Arginine really doesn't work the way you think it does. In fact, if you take it long-term, it can actually hurt your erections and damage your cardiovascular health. But here's the good news. There are better natural powders out there that can genuinely help. Powders that work through a completely different pathway your body actually responds to. In this video, I'm going to explain why L-Arginine doesn't work for most men and can actually backfire, because most men don't have an L-Arginine deficiency. So when you take extra, your body converts it into a harmful compound called ADMA that blocks nitric oxide production and damages the blood vessels you're trying to heal, essentially creating the exact opposite effect you wanted. I'll reveal the 3 powders that work better by using the nitrate pathway. They bypass the system that limits L-Arginine's effectiveness and work gently over time to heal your body's ability to produce nitric oxide naturally instead of forcing a temporary spike. And I'll show you exactly how to use them for best results, the precise dosages from clinical studies that showed measurable improvements, the timing that maximizes absorption, and the shocking truth that 64% of commercial beetroot powders contain almost no active compounds despite their label claims, so you don't waste money on useless products. I'm Dr. Elizabeth Rains, and after years of helping men restore natural function, I've learned that sometimes the most powerful solutions aren't the most popular ones. They're the ones that actually work with your body's biochemistry instead of overwhelming it. And I want you to know something right now. If you've been taking L-Arginine and not seeing results, or even feeling worse, it's not your fault. You were following advice that sounded logical but wasn't based on how your body actually processes these compounds. Stay with me until the end, because I'm also going to reveal the one daily habit that determines whether these powders work at all. Something most men over 60 are doing wrong that sabotages circulation. And when you fix it, everything we discuss here becomes exponentially more powerful. Before I tell you which powders actually work, you need to understand why L-Arginine doesn't. Because once you see the biochemistry, you'll understand why so many men feel frustrated after spending months on supplements that promised results but delivered nothing. Here's what's really happening, and I wish someone had explained this to you before you spent money on L-Arginine. Arginine is an amino acid your body uses to make nitric oxide, the molecule that widens blood vessels to allow blood to fill the penis and create an erection. So, the logic sounds perfect. More arginine should mean more nitric oxide, which should mean stronger erections, right? But here's the problem most doctors won't tell you. Most men don't have an L-Arginine deficiency. Your body already gets it from food and produces it on its own. And when you start taking extra supplements, your body doesn't know what to do with the surplus. It doesn't turn it into more nitric oxide. Instead, it has to metabolize and remove it. When you take high levels of L-Arginine, instead of creating large amounts of nitric oxide, the extra gets converted into a harmful metabolite called ADMA, asymmetric dimethylarginine. And here's what breaks my heart about this. ADMA actually blocks nitric oxide production by blocking the enzyme your body uses to make it. So instead of helping, you're literally creating a substance that prevents the very thing you're trying to achieve. ADMA is dangerous because once it blocks nitric oxide production, this leads to blood vessel dysfunction, endothelial cell damage, which is the foundation of cardiovascular disease. So instead of helping your erections, you could actually be damaging your heart health over time while wondering why nothing is improving. If you've been taking L-Arginine and wondering why it's not working or why you feel worse, now you know. It's not because your body is broken. It's because L-Arginine only works if you're genuinely deficient, which most men aren't. The good news is, there are powders that work through a completely different pathway that's far more effective and safer. The first powder that actually works is beetroot powder. But before you rush out to buy it, you need to know about 2 serious risks that affect many men, because not all beetroot powders are safe or even effective. Beetroot works differently than L-Arginine through a completely different pathway. Its power isn't in amino acids, it's in nitrates, the same nitrates you get from leafy greens. When you consume beetroot powder, bacteria on your tongue activate the nitrate, converting it to nitrate, and then enzymes in your body create nitric oxide. This pathway bypasses the system that limits L-Arginine's effectiveness. Another key difference, L-Arginine's effect is short and inconsistent, whereas nitrates work gently, last longer, and over time can actually heal your body's ability to make nitric oxide by gradually dilating blood vessels and improving circulation. That's why athletes love beet juice before workouts. It genuinely improves oxygen delivery and blood flow where it's needed. But here are the cautions you must know, and I've seen too many men suffer because no one warned them. First, beets and beetroot powders are very high in oxalates, natural compounds that in high amounts can create crystals with calcium that turn into kidney stones, worsen kidney function, and crystallize in joints, making arthritis worse. So if you have arthritis, kidney stones, or kidney dysfunction, beetroot is not a safe option for you. Second, when beetroot powders were analyzed in labs, 64% of products tested did not meet the claims on their packaging. Many cheap powders and even some expensive ones are actually low in nitrates, so they're completely useless. Research shows fresh beets provide significantly more antioxidants and nitrates than most powders. So if you choose beetroot, either use fresh beets or find a brand that's lab-tested and transparent about nitrate content. But for most men, especially those with kidney or joint issues, there's a better option that works even more powerfully without the oxalate risk. The best 2 options are arugula powder and celery powder, and these work even better than beetroot without the dangerous side effects, which is why I recommend them to almost every patient. Both arugula and celery powder boost nitric oxide the same way as beetroot. They're rich in nitrates activated by bacteria in saliva and gradually converted into nitric oxide. The difference? Unlike beets, arugula and celery don't contain oxalates. That means if you have kidney problems, arthritis, or worry about them, you can safely take these regularly. Arugula is actually one of the most nitrate-dense vegetables out there, even higher than beets. So if you're low on nitrates, adding arugula powder to your daily smoothie can make a noticeable difference within weeks. Celery powder is packed with antioxidants, vitamin C, and vitamin K, and contains a flavonoid called apigenin, which reduces inflammation and supports vascular health. A review called The Cardioprotective Role of Nitrate-Containing Vegetables found that even in a short period, nitrates from these vegetables significantly boosted nitric oxide levels in blood. The results were clear. Better vasodilation, blood vessels opening, better blood pressure, and stronger erections. As for dosage, studies showed about 400 milligrams of nitrates per day was enough to show improvement in circulation and blood pressure. For reference, that's roughly 100 grams of fresh arugula, or about 1 to 2 teaspoons of high-quality arugula powder daily. Here's your protocol. Start with 1 teaspoon of arugula powder or celery powder, mixed into a smoothie or water, taken once daily in the morning or before bed. The raw powder doesn't taste great on its own, but mixed into a smoothie, it's perfectly tolerable. Within 2 to 4 weeks, most men notice improved circulation, better blood pressure, and gradually stronger morning erections, not because of a forced response, but because your blood vessels are healing and producing nitric oxide naturally again. This is your body remembering what it's capable of when you give it the right support. Gentlemen, here's the truth. L-Arginine sounds logical, but for most men, it doesn't work, can actually backfire by creating metabolites that block nitric oxide production. Beetroot powder works better through the nitrate pathway, but carries oxalate risks, and most products are low quality. Arugula and celery powder are the best options. They work through the same nitrate pathway as beetroot, but without the side effects, and they're more nitrate dense, so you need less. Your body is still capable of producing strong, natural erections. It just needs the right fuel through the right pathway. These powders give you that pathway, safely and naturally. You deserve to feel strong, confident, and alive again. And this simple change can help you get there. If you're on blood thinners or nitrate-based medications, check with your doctor before adding nitrate-rich powders. There's no shame in seeking guidance. Your safety always comes first. So here's my challenge. Stop taking L-Arginine if you currently are, and switch to arugula or celery powder for 30 days. Start with 1 teaspoon daily, mixed into smoothies or water. Pay attention to your energy, blood pressure, and morning erections over the next few weeks. The changes will be gradual but real. But here's the thing. These powders give your body the raw materials to produce nitric oxide and improve circulation. But if you're engaging in habits that damage that circulation or deplete the hormones needed for morning erections, if you're doing something daily that's working against everything these powders build, you're only getting half the results you deserve. Click the video on your screen right now. I'll reveal how often men over 60 should actually masturbate for optimal health, because frequency affects circulation, prostate health, and morning erections in ways most men don't understand. It's called How Often Should Men Over 60 Masturbate for Health? And when you combine the right supplementation with the right frequency, the results are powerful. Without both working together, you're fighting yourself. With both, you're unstoppable.